Good evening, friends, and thank you for tuning in to Crime Time with DutyRon and Ed Wallace. Hey, this is not going to be a traditional live stream that you guys are all used to. This is going to be an update, my cancer journey, the radiation treatment that I'm going to be getting. And I wanted to just come live first and foremost to the general public here. Crime Time with DutyRon and Ed Wallace, we've grown to 370,000 subscribers, which is really unbelievable. You guys keep subscribing, you guys keep sharing. And I want to thank you for not just only the community, but for all the people who have been sending me messages, because I have to thank you guys first and foremost. The emails, the text messages, the DMs, the phone calls, the reaching out on social media. I can't tell you how much this has helped me with my cancer journey. And non-Hodgkin's lymphoma follicular, which is a slow-growing cancer in your blood system. It's a blood cancer. It's a really, it's a hard cancer to figure out because all of the diagnostics leading up to your treatment, it has you in suspended animation because you don't know if it's good, bad, or anything in between. And there's no good cancer. Like some people say to me, hey, DutyRon, you got the good cancer. It's stage 1. You caught it early. It's not anywhere else in your body. But is any cancer good? I don't think any cancer, like skin cancer, which I had 6 bouts of that prior to this. No cancer is good. And I come to realize that there are so many people in this community that are fighting, that have fought, that have lost loved ones to the battles. I've heard so many stories since coming out in October last month about my cancer journey of all of you guys who are suffering or have suffered with loved ones, and the stories and the people who shared with me privately are heart-wrenching and are so inspiring at the same time. It's heart-wrenching and inspiring. But I was lucky. I went to NYU Langone to have a first set of eyes on this cancer. And then I knew that I was going to go and get a second opinion. I went to the best, Sloan Kettering Cancer Center. Memorial Sloan Kettering Cancer Center is well known throughout the world. People travel from across the globe to New York and to receive treatment from Memorial Sloan Kettering. So I went to Memorial Sloan Kettering, and this non-Hodgkin's lymphoma that I have, I received 2 separate opinions. The NYU Langone team wanted to hit me with up to 20 sessions of radiation. That's 5 days a week for 4 weeks. Now, they described the radiation therapy as baby doses, very small doses of radiation targeted at my cancer in my cheek, which is right here. I was good with that because I was afraid. I'm not an expert at cancer. I don't know anything about this. And I was like, okay, I'm going to get a second opinion. I guess they're going to say the same thing. They're going to attack this with radiation the same way as NYU Langone. But I went to Sloan Kettering, and last time I updated you guys, I had the core biopsy on my cheek. You guys in the chat, if you saw the YouTube short that I did, I was in a hospital gown. And I was holding the phone. My wife was with me. Mrs. DutyRon was with me. And I was like, hey, guys, I'm going into this needle core biopsy. And I got that and went through the PET scan. And then I was waiting to get a bone marrow biopsy. But in between the bone marrow biopsy, getting it done, I went to Sloan Kettering. And when I went to Sloan Kettering, it was a Monday. The dates, I don't have the dates in my head, but this all happened very quickly in the month of October and leading into November, and leading into this month. But I went to NYU and I had the bone marrow biopsy scheduled on a Wednesday. I went on that Monday to Sloan Kettering and I got a second opinion, and they told me, you don't need a bone marrow biopsy. We can do a blood test to show markers in the blood if you have bone cancer, if the cancer is in your bones, we don't need to subject you. This is Sloan Kettering talking. We don't need to subject you, DutyRon, to a bone marrow biopsy because we could check it through a blood test. And if those markers indicate that there's blood cancer in your bones, then we could do the bone marrow biopsy. And I was like, oh, I was floored. I was like, holy shiitake mushrooms. You mean I don't have to get a needle in my hip and bore into my bone? You could take blood from my arm right here, right now, and do a test and tell me in a day or two that either yes or no. I was happier than a pig in shit. I hate to, that's like a bad terminology to use, but that's what came to my mind. I was like, I'm going to roll in this. I'm going to be a big old hog and roll in this feces here. I couldn't believe it. So my wife and I looked at each other and we were like, Sloan Kettering this is what we're going with these guys. So they took blood from me on that Monday. I immediately canceled my NYU Langone Wednesday scheduled bone marrow biopsy. I canceled that. And the doctor's office called me back and was like, hey, Popeye, thanks for blowing your feathers all over the place here. So I actually canceled through my NYU Langone app. I canceled the bone marrow biopsy, and the doctor actually called me. The actual the hematology oncologist from NYU called me and said, hey, why are you canceling it? And I said to him, I told him I was going to Sloan for a second opinion. I said, they told me I don't have to have a bone marrow biopsy unless this blood test comes back. And he said, oh, we don't have that technology. We don't have a blood test. We go straight to your bone and we bore into your bones. That's our procedure. Not saying it's a bad procedure, but if I don't have to get it, why do it? So Sloan Kettering, I canceled it. A few days later, they told me negative on that blood test for bone cancer. No need to do a bone marrow biopsy. Don't have to go through that. There's all kinds of risks associated with it. You can get infection. You can get all kinds of stuff. So I was so delighted with Sloan Kettering. And with non-Hodgkin's lymphoma, this is a follicular lymphoma. It's a slow-growing lymphoma. I now had to go and get a consult from a radiation oncologist, just the way I did with NYU. Sloan Kettering required me to go to their radiation oncologist. And I already had the treatment plan from NYU Langone's radiation oncologist. He wanted to hit me with anywhere from 15 to 20 rounds of radiation, small doses over 5 days a week. So I get 2 or 3 days after that bone marrow blood test came back negative, I go to Sloan's radiation oncology, same location. It's right here, local, close by my house. And the radiation therapist says to me and Mrs. DutyRon, we're happy that you caught this early. It's 19 millimeter mass in your cheek. Stage 1, relatively simple. We're going to hit you with 2 high doses of radiation therapy. 2 days. I have to go for 2 bigger radiation sessions in my cheek. They do a PET scan 2 to 3 months later. I actually have it already scheduled for March, so 3-4 months, whatever, after the 2. I went from 15 or 20 radiation blasts to 2. And then they check it, and then they say, if it's gone, you're done. If it's not gone, we hit you with another 1 or 2. Their approach is do less radiation and harm to your body and get to the same result. Now, I questioned them right away and I said, wait a minute. Why is there this extreme contrast? Why is NYU Langone telling me that I need 15 or 20 blasts and you guys are telling me 2? He said, we do a lot of research at Sloan Kettering. Memorial Sloan Kettering does research, and we found a very high success rate with the same cancer that you have, the same type, size 1, stage 1, It could be here, it could be in your neck, it could be in your lymph nodes under your arms. We know that we have lymph nodes throughout our whole body, but my mass is right here on my cheek. He said, we have experienced a high success rate with very minimal radiation. Why subject you to extra radiation if we don't have to? If we could get the result done. And he wasn't bashing NYU Langone. Memorial Sloan Kettering said that is the national standard. That is the standard therapy to attack your cancer. But we take a different approach. We take a less invasive approach. And we want to do the same thing. We want to get to the same result, you being cancer-free, with far less radiation. So I was thrilled, people. I was thrilled about this. And this is such great news. And I got to tell you, the main thing that I have to report to you guys, the main symptom that I have is being tired, being fatigued. Like I could literally go to sleep at 7 or 8 o'clock at night, and I could wake up after sleeping 10 or 12 hours or 9 hours or 8 hours, and I wake up tired. So my only complaint and my only symptom with this, no night sweats really, just fatigue is what I have. And I think a lot of it is mental. I think a lot of my fatigue is happening because I'm going through such anxiety about cancer that I think it's playing mind games with me, and I've lost a lot of interest in trying to, do the things that I love to do, which is this. I love to live stream, but I just don't have it. Like I just don't have the same drive to want to do it. I'm going to work. I'm trying to go through the motions, staying busy, but this doing YouTube live streaming and covering these cases, I love that. I love to do it. I love going live with you guys, but this cancer is like taking me away from it. And it's only going to be temporary until I can get to ring that bell and say that we are done with this cancer. But for the rest of my life, I have to get checked every 6 months. For the first 2 years, I have to get a PET scan every 6 months. And then as the years go on and I keep getting these hopefully clean PET scans, it'll just be eventually once a year. But I tip my cap to Memorial Sloan Kettering Cancer Center, because right now I feel like I got a new lease on life, and it's not going to be as bad as what I thought it was going to be. And of course, you go to Googling, right? You go to Google and you look at, non-Hodgkin's lymphoma, you look at stage 1, 2, 3, 4, and all the different variables. What does radiation do to your face? Like, does it mess your teeth up? And I started researching about dental and the problems that happen, because don't forget, it's right here. And what's on the other side of this cheek? My teeth. So I'm worried about teeth and so forth. But let's listen to a little video from a doctor in the Tampa area. She has some good information. I watched this video before we went live here, and I want to share it with you because it tells you a great deal about what's going on treatment-wise. And this is a medical oncologist and hematologist at the Institution of Hope and Innovations. She's talking about non-Hodgkin's lymphoma. That's what I have. And mine is the follicular version. There's about 90 different versions of non-Hodgkin's lymphoma. So let's take a listen.
Dr. Kamal Sharma, medical oncologist and hematologist for the Oncology Institute of Hope and Innovation in Lakeland, explains its symptoms and how far treatment has come.
Non-Hodgkin's lymphoma is a disease of the lymphocytes, and these are really immune-fighting cells.
She says you can think of this system like a string of lights.
If you think of the lymph nodes like the bulbs on those strings of lights, those strings of lights really make up your veins and your arteries. And so these lymph node bulbs can be almost anywhere in the body.
There are 70 different types of non-Hodgkin's lymphoma that fall in 2 categories, the B cells and T cells. Fonda revealed
I have the B cell non-Hodgkin lymphoma. Mine is the B cells.
In a blog post, she has B cell non-Hodgkin's lymphoma, which Dr. Sharma calls more treatable. It mainly affects people over the age of 65. And like many diseases, the earlier the diagnosis, the better. So be aware of the symptoms.
Fevers, night sweats, chills, being really tired. And a lot of times people will feel lumps or bumps in their neck, their armpits, or their groin most commonly.
Risk factors are hard to pinpoint, but Dr. Sharma says there are some hereditary cases and cancers linked to environmental exposure and autoimmune disease. Imaging like CAT or PET scans help doctors determine treatment.
A lot of times we're using chemotherapy, but now in combination with targeted therapies or what we call monoclonal antibodies. And this is sort of what spares you from losing your hair, if you will, or feeling so sick. And so you can sort of live with this.
She says typically patients have about 6 cycles of chemo followed by maintenance therapy for up to 2 years to make sure it doesn't return.
So there's just a little bit of a story. And I've been watching a bunch of different cancer journeys, like many people along YouTube that have gone through this. Jennifer, thank you for the $10 Canadian. She says, I've been a bush watcher for longer than I can remember. If anyone can beat this, it's you. Sending strength and love and prayers. Thank you for that. Thank you so much. I'm going to go to the chat here. CGC Vinyl says, I have the same follicular non-Hodgkin's lymphoma. I've had 3 reoccurrences in 10 years. And I'm glad you brought that up, CGC Vinyl. That's the one thing that the doctors at Memorial Sloan Kettering and NYU Langone told me. They said the follicular lymphoma has a very high reoccurrence rate, 60%. Right around 60% of patients get reoccurrences over the time, and he described it as more of an annoyance than anything. It leads to anxiety, it leads to depression, because you need to get for the rest of your life these PET scans, and every PET scan that you get from now on going forward, you're going to be thinking, is it going to be somewhere else? Is it going to be in my chest? Is it going to be in my God? I don't even want to talk about it, but if that's the worst of it, I look at some other people who have had bouts with cancer and didn't win, like my father, like many parents and many people that are out here and loved ones that they've lost along the way. My father had bile duct cancer, and it was so brutal, and it took his life so quickly and violently. When you think of like for me, when I think of cancer, I think of my father, and I think of some of the members of the NYPD that I lost to cancer related to 9/11 World Trade Center first responders that get cancer of different types. And I mean, I consider myself lucky, and I have like a bit of survivor's guilt here, because so many of my colleagues that I worked with alongside the World Trade Center and the pile at September 11th at the World Trade Center, they're no longer here, and their families grieve and miss them. So for me, it's like, I'm my head, and I'd like to tell you guys I'm perfectly fine, but my mind games, I'm trying to say this in a nice way, my mind is playing tricks on me, because I'm continually thinking about doom and gloom and about what if I get a clean bill of health and we get rid of this in my cheek, and then next year it's in 5 different places in my body. Like, so it's so hard, and I'm mentally strong. I don't suffer PTSD from my World Trade Center response and my policing. Seen a lot of death and destruction and horror over the years, but like, I'm mentally strong. But this, man, I can't even tell you how this has changed me. It's really changed me big time. It's a big test for me, and like, I'm trying to go through the motions and be normal and be just kind of, I'm telling everybody and close to in my family, obviously I'm going to be okay, but I don't know if I'm going to be okay. I don't know if a year from now or 5 years from now. I just highlighted this comment here. Non-Hodgkin's, I had 3 reoccurrences in 10 years, but you're still here to talk about it. And that's why I'm still sticking with that comment. And thank you for that. I want to thank all of the people who, again, who have sent love and prayers and continue to pray for me. You guys are like a second family to me, and it's like a huge family. It's such a great thing to have a second huge family. You guys are giving me strength and giving me, like, every morning I go and look at the comments, and you guys are posting comments on my older videos and my newer videos and all of these uploads that we're doing. And forgive me for not going live all the time with breaking news and with all this stuff. It's just, I can't do it. I want to do it. Trust me, you guys know I want to do it, but I can't. I have to put myself first, and I got to put this battle of, I want to just put it to the side. I want to get past this end of this year and get into 2025 and get that March PET scan clear. And so please grin and bear a little bit of absence from me. I'm not saying I'm going and I'm done. I'm just saying that it's going to be a little less. And please understand that it's not because I don't want to come and do this. It's just that I'm just so wrapped up in staying focused on getting better, and they said I'm going to lose some hair and, like, possibly lose my eyebrows and my beard and mustache. So I'll be looking different. I think there's going to be 2 strong doses of radiation. I don't know how my body's going to react to it. Hopefully I won't lose that, but I don't care. I'm not worried about my hair on my head because it's gone. But so if my appearance changes, that might stop me from a little bit going live, depending on how I feel. I think I'll be okay, but we'll see how it goes. I want to just say thank you again. I can't thank you guys enough. And I know I've said this 3 times already, but thank you isn't just enough. I want you guys to really know that, like, at some of my weakest points in this journey of finding out that I have cancer, like, nobody's journey is the same. Like, no 2 people process this stuff, and no 2 people's bodies react the same. We're all individuals. So I don't know if I'll have adverse reactions to this radiation. I don't know if anything will happen going forward, but I'm hoping and praying that it doesn't. And your prayers and your positive comments mean a lot to me. So keep them coming, and just understand that, I'm going to be down and out for a little bit. And I'm not going anywhere. Kristen is doing a great job at uploading content for you guys, repurposed content from our live streams. And again, I thank you guys all for sticking with me here on Crime Time with DutyRon. Let me just highlight a couple of comments. Pete and Richella, thank you for being here. Coffee Cake says, hoping this is just a thing. Take care. Yeah. Thunder Horse says, DutyRon, make sure you get that cream to put on after radiation. It helps a lot to keep from the burning. And I'm worried about the inside as well, inside of the mouth. Truth, DutyRon says, Stacy Michaels. Joey Brooklyn is here, my brother. Joey, I got that scapular. I got it on Saturday, yesterday. So thank you for that. Just a wonderful thing that you sent me. Thank you all. I'm going to be wearing it starting tomorrow. I'm going to put it on. I'm going to put it on in the morning, start my week fresh. Cat H says, we will be waiting for your return. No one can always be strong. I'm trying, Cat H. I've had some pretty weak moments, but you guys have really helped me get through it. So I thank you. Pippa Dot says, focus on you. Kit Lee sending hugs. Yeah, I focus on me. Don't get me wrong. The reason I'm absent from here is because I'm focusing on me. But I care about you guys enough to let you know publicly that it hurts me not to be live with you guys more often. I know that a lot of you guys get enjoyment out of and learning from Ed Wallace and myself, but it's just too much going on. I'm going for blood tests. I'm going for this test. I'm on the phone. I'm doing all kinds of stuff. And, I want to wish everyone a happy Thanksgiving. If you celebrate and you're in the United States and you celebrate Thanksgiving, it's coming up on Thursday. And, you know, we always say on Thanksgiving, I want to talk about the things that I'm thankful for. And I'm going to pray with my family as I do every Thanksgiving. And I'm going to talk about the things that I'm thankful for. And we'll all speak at the table before we eat about what we're thankful for. And I want you guys to know, one of the things I'm going to tell my family, my extended family, and my friends and people who are at my Thanksgiving table on Thursday is I'm thankful for you guys as well. I'm thankful for this community. You guys mean a lot to me, and I thank you so much. I can't say it enough. So I'm going to end it on that. Keep praying for me. Your prayers have meant a lot and have done a lot. So I will see you very soon. God bless, and talk to you on the next live stream. Peace. I love you guys. Thank you.